يعطيكم العافية جميعا. بهاي المحاضرة راح نغطي topic هي ال antibacterial strategies بال endodontics. basically زي ما حكينا دائما إنه ال endodontics is all about disinfection of the root canal system. But to be able to do proper disinfection, you need to do proper or to use proper antibacterial irrigants so that you increase your success rate of the treatment. Always remember that no matter what certificates or what degrees you get, you will always have something new to learn. There's always be something bigger to learn and something you don't know. No matter what, حتى لو كنت specialist حتى لو كنت there's always be something that you need to read more about because you don't know. Okay. Basically زي ما أخذته بالمحاضرات الأولى, the goal of endodontic treatment is to eliminate diseased pulpal tissue and to create an environment that will allow for healing of periapical tissues and prevent development of apical periodontitis. Basically, endodontics, our root canal treatment, is all about disinfection of the root canal system and preventing infection or reinfection of the root canal system. فإذا كان عندي أنا الكنالز كان عندي مثلا infected pulp chamber بس الكنالز were sterile, I want to prevent the infection of the canals. بس إذا كان عندي الكنالز infected, I want to eliminate this infection أو do disinfection of the canal and prevent reinfection. هلا prevent reinfection أو preventing the infection of the root canal system, it occurs mainly by obturation. With disinfection, it occurs mainly by shaping of the canal so that we able to use irrigants and to do chemomechanical irrigation or chemomechanical disinfection for root canal system. basically this study is a very classical study endodontics. يعني هي where they proved أو كاكيهاشي proved إنه in order to have apical disease, in order to have the endodontic disease, you need to have microbes. Basically عمل study كان فيها الراتس, كان فيها germ free و conventional rats, عمل pulp exposures inside the rat's teeth. الconventional laboratory rats صابهم apical periodontitis و pulpal necrosis, والجيرم فري اللي هم كان sterile البلب عمل healing وسكر بايدنتين deposition وما صار في أي periapical lesions and or any pulpal necrosis. But that's very important to understand that it's all about the microbes that affects the health of the pulp. Here you can see the complexity of the root canal system. Basically, that's an upper molar. You can see كيف three main canals وعندي ال MP2. It's the one connecting them. So basically, you can see how there are complexity inside the canal system itself. في عندي deltas, في عندي fins, في عندي isthmuses. والcanals, they are not circular, so that's very important to understand and to make sure that you keep that in mind when cleaning and shaping the canal, because the canal is not round cylindrical, it just varies in shape and in width, and it's almost never circular in diameter. That's another radiograph. It shows root canal system before and after cleaning and shaping. You can see there are still آخر صورة على اليمين الصورة رقم C. You can see في still traces من root canal system that were not touched بالمرة. And that happens as well when you do cleaning and shaping again, because the canals are not circular. So you just need to shape the canal to enlarge it to a point where you can introduce the irrigant. The irrigant will do most of the work. Okay. By doing shaping alone, يعني إذا إحنا بس عملنا preparation للcanal alone without doing any irrigation, we only disinfect around 40 to 50% of the canal اللي هي by only instrumentation. The rest, which is 50 to 60%, is done by irrigation. And the purpose of the shaping of the canal basically is one, to allow irrigant introduction into the canal, and the second to allow the obturation, so that to provide a hermetic seal to prevent reinfection. Again, that's another section. You can see بهاي الصورة العكس صار الred are the untouched areas. You can see كيف ال MP2 يعني it was not even touched. You can see قديش في من الباليتال قديش في من الدستوبكل. They were not touched at all. So obviously if they were not touched إذا ما عملت irrigation حيكون place where the microbes will stay active, will stay alive, and they will cause the infection of the root canal system. Okay, this gets us to the question again, is mechanical instrumentation alone enough? زي ما حكينا أكيد لا، لأنه يعني by doing instrumentation alone you're touching أو it's fixing only around 40 maximum 50% of the canal. Doing the irrigation will deal with the rest and will do the actual antimicrobial effect of the root canal system and actual disinfection of the root canal system. So again, irrigation is an essential part of the root canal debridement because it allows for cleaning beyond what might be achieved by root canal instrumentation alone. Disinfection of the root canal system can happen or can occur in two different ways, or can be introduced in two different ways. The first would be through the irrigants اللي بنستعملها short period of time during the actual treatment time when the patient is on chair, and there is the medicaments which can be days or 4 days or for several weeks, and these are between appointments. So we twist the canal, we place them inside the canal between appointments to gain some sort of antimicrobial effect and some sort of disinfection of the root canal system. If we are talking about the irrigants, the ideal properties of an irrigant is it should act as a lubricant, should have antimicrobial effect, dissolve organic debris, and should be able to flush the debris, the dentinal debris that were left due to instrumentation, and possibly any pulpal tissue debris. It should be biocompatible and should be ideally it should be cheap. Okay, so the functions of the irrigants are used to clean the root canal and are used in association with the shaping instruments. Their functions mainly are lubrication of instruments used to shape the canal, so that they decrease the friction and decrease the risk of instruments getting stuck and fractured inside the canal. Again, flushing out of gross debris, dissolution of organic and inorganic tissue. The organic is mainly the pulpal tissue, inorganic the dentinal debris that resulted from the cutting of the root canal while shaping. And obviously the most important factor is the antimicrobial effect. So basically the classification of irrigants, we're going to classify the irrigants into two different main types. They are chemically inactive irrigants, which are water and saline. These are purely inactive, so they don't have any antimicrobial effect whatsoever. They just flush the root canal and basically they just aid in lubrication. Then we have the chemically active irrigants, which are the sodium hypochlorite, the oxidizing agents such as hydrogen peroxide, chlorhexidine, and chelating agents. If we are talking about sodium hypochlorite, mainly it's Clorox. It's Clorox in its purest form. It's the one that's can be bought from any supermarket. It's the most commonly used irrigant in endodontics, and it's the most effective irrigant that's used at this point in endodontics. Hydrogen peroxide, it's rarely used, it's not as common, does not have as broad spectrum as antimicrobial as the sodium hypochlorite, so it's much less used. Chlorhexidine, um, so as well, it's an irrigant that it's also can be found as a mouthwash. It does have antibacterial effect, but it's less broad uh, than the sodium hypochlorite. Chelating agents such as a material called EDTA, it helps in removing the inorganic layer, so it basically acts as a chelating agent, decalcifying the dentine, um, to remove any blockage, to remove any dentinal debris inside the canal. You can just use it to help you, but you need to be careful because if used without being careful, it will cause a ledge. Basically, just kind of soften the dentine to the point where you just can easily create a ledge. A very important part of the irrigation basically is to be able to introduce it. So it does not matter if the irrigant has a very broad spectrum antimicrobial effect or not, if you can't introduce it inside the canal to the correct depth. So basically, to do that, you need right type and right size and gauge of the needle for the syringe. Usually it's 27 or 30. I prefer the 27 gauge needle because the 30 usually gets blocked by dentinal tubules when you are doing irrigation, so it can be blocked easily, the 30, while the 27 can't be blocked as easy and still does deliver the irrigant to the right depth. Usually we aim to introduce the irrigant to within 2 millimeters short of the working length, and by that you can get your irrigant to the full working length. So basically, if you introduce the irrigant to 2 millimeters short of the working length, your irrigant will reach to the working length, because the irrigant can maximally travel around 1 to 2 millimeters beyond the syringe needle tip. So other than that, won't travel. So you can't put it at the orifice and expect it to go all the way to the working length. You need to introduce it 2 millimeters short of the working length. And of course, I don't need to, and you should not be placing high pressure on the syringe. It should be with the index finger, very light pressure, and doing irrigation, keeping the needle loose inside the canal. Never introduce irrigant when the needle is stuck inside the canal. Make sure it's loose, and while irrigating, just keep getting the needle out and in, reintroducing the needle, and just get it out to allow for the irrigant to get out of the canal and introduce a new irrigant. So very important, never use too much pressure, just with the index finger, very light pressure. And the other one is make sure that you get it to the right depth while the needle is not stuck and very loose inside the canal. Again, talking about a bit more about sodium hypochlorite, since it's the most commonly used irrigant, it usually occurs in concentrations of 0.5 to 5.25%. That's the highest concentration that you can get. Even the pure Clorox or the pure sodium hypochlorite, you will get it in that percentage, either from 0.5 to 5.25. It mainly works by dissociation into hypochlorous acid. It has both antibacterial and antifungal, and it has an excellent tissue dissolving ability, so it can be used when you have basically very inflamed pulp and there is loads of bleeding. You can just use sodium hypochlorite and it will get rid of all the pulpal tissue. It will dissolve it, and then you will get rid of the bleeding. But you need to make sure that there are no perforations, because if you introduce sodium hypochlorite into perforation, you will get sodium hypochlorite accident, which is very dangerous, very risky, and can cause bone necrosis, can cause nerve damage. So as long as you are sure that there is no perforation but there is loads of bleeding, just use sodium hypochlorite as an irrigation, and it will get rid of all the pulpal tissue that's causing the bleeding, and it will stop the bleeding almost immediately. Again, apical reaction, I'm talking about if it gets extruded into the apical tissue, you will get profuse bleeding from the apex. So the canal will be dry, but when you do irrigation, suddenly it will get profuse bleeding. The patient might feel severe pain, sudden severe pain with profuse bleeding. That's indication that the sodium hypochlorite went beyond the apex. So you need to stop, you need to rinse with saline to get rid and to dilute the sodium hypochlorite that's in there. And definitely always you should be using a rubber dam when doing endodontic treatment, and this will protect the patient from swallowing any sodium hypochlorite. And I don't think anyone of you would be fine with swallowing Clorox. So basically, the sodium hypochlorite works mainly by dissociation to hypochlorous acid, which affects the cell wall. It attacks the cell wall and disintegrates the cell wall, which leads to bacterial death, and by that have its antimicrobial effect. Again, if you are talking about sodium hypochlorite, there are ways to make it more active. Basically, one way to do it is by heating the sodium hypochlorite. If you heat it to around 30 to 40 degrees, and you will have a better effect, especially in dissolving pulpal tissue. So its main effect increase in dissolving pulpal tissue when you heat it. Another way is to activate it is to pump it. So basically you place the irrigation inside the canal and use a gutta-percha cone. You just pump it, you just place it inside the canal while the sodium hypochlorite is in, and that's the way you make sure that sodium hypochlorite touches more of the walls of the canal and gets into the isthmuses and fins that are inside the canal. One thing about the sodium hypochlorite effect on dentine, there are various studies that talks about the effect on dentine. Usually if it's used alone, does not have that much of an effect on dentine, but if used with other irrigants, it can have detrimental effects on the dentine. One way to improve your intracanal medicament between appointments is to mix the calcium hydroxide with sodium hypochlorite and place it inside the canal as a dressing between appointments. That way you will increase the antibacterial effect of the inter-appointment dressing. Again, I'm talking about here activation and delivery method of the irrigants. If you're talking about manual techniques, basically the one that you use is syringe irrigation with needles. Passively, the one that you use in the lab or with agitation. Basically, that way you can deliver the irrigant distally or laterally by using a GP cone. You just place the irrigant inside the canal, you just use a GP cone and just pump the irrigant so that just spreads laterally and gets into isthmuses and fins. Another way is to use very small brushes, dental brushes. They are the TP brushes. If anyone, most of you, I think anyone who had ortho treatment before would know them. They are just interdental brushes, the TP brushes. They are very small. They can't be placed inside the canal. And if you place the irrigant inside the canal and just use the brush, you can basically do some sort of mechanical and chemical agitation and irrigation of the root canal system. Again, manual dynamic irrigation is the well-fitted gutta-percha cone, which will spread the irrigant into the walls and make sure you have a better antimicrobial effect. Again, as because there is manual, then there is machine assisted techniques. They are the same brushes, they can be rotary, they can be placed inside the canal just to brush against the wall to disturb the bacteria, disturb the microbes that are residing there, and improving the effect of the sodium hypochlorite. Um, Obviously, there is continuous irrigation during rotary instrumentation, basically during preparation of the canal. There are some machines that can deliver irrigants um, at the same time that the canal is being shaped. And also there is sonic and ultrasonic irrigation using the scaler used to, so basically you just, I'm not going to details with the sonic and ultrasonic irrigation because we will get details later on in fourth year about this one. But basically just like the scaler that's used to do scaling and polishing for the teeth, there are some tips that looks like files. You can just place them inside the canal while the irrigant is still there, and they will activate the irrigant. Another irrigant is the hydrogen peroxide. It's rarely used. I don't think the people that use it make more than 1% or 2% like as an irrigant, because it's very rarely used. It's usually in 3% concentration. It can be used with or without sodium hypochlorite. Basically, it works by dissociating and producing oxygen-free radicals, which eliminates anaerobes. Due to the oxygen production, there is production of loads of bubbles, which may prevent adequate contact with the debris and with the walls of the root canal. And also one of the main disadvantages, has very limited shelf life, so it needs to be used as soon as it's opened, or as soon as the bottle is opened. These are the main things that concerns with the hydrogen peroxide. The chlorhexidine, it's used in various forms in dentistry. It can be used as a mouthwash, and it can be used as irrigant in endodontics, even though it's not that much used, but it still can be used. It's a heavy scrubs natural product, usually effective in 2% concentration. It's effective against gram-positive bacteria, which are more common in the secondary or retreatments than primary. Usually primary, they are obligate anaerobes or facultative anaerobes, while in the secondary or retreatment, they are gram-positive aerobic bacteria. The good thing about it is that it has a substantivity up to 12 weeks, which means it can adhere to the dentine and stay there for 12 weeks just after one time irrigation. It's very good in flushing the debris and as a lubricant. The main problem with it is does not dissolve the organic debris, so it won't dissolve the pulpal tissue, and in addition to the fact that it's not active against gram-negative anaerobic bacteria, which are more common in the primary endodontic treatment, like the first time endodontic treatment. The intercanal medicament, going back to the intercanal medicament, which is the second part of disinfection or antibacterial strategies of the root canal system. If root canal treatment cannot be finished in a single visit, root canals are dressed with medicaments. You should never leave the canal empty. We should always place an antimicrobial dressing inside it. Medicament is an antimicrobial agent that's placed inside the root canal between treatments to destroy remaining microorganisms and prevent the reinfection, or at least to keep the root canal microbiota as the same as it was when you finished your treatment, so that you prevent any division of the bacteria and increasing the numbers of bacteria. The main medicament for the inter-appointment dressing is the calcium hydroxide. Again, we talked about it. Its trade name is the Hypocal. It has very high antibacterial. It has very high pH, around 12, and that's why it's antibacterial. Basically, again, it attacks the cell wall and cell membrane of the bacteria and dissociates them, which kills the bacteria. It denatures the protein due to its high alkaline pH, and it's can be very synergistic with sodium hypochlorite. Again, as I said before, you can mix it with sodium hypochlorite and place it as dressing inside the canal. It has cytotoxic local necrosis, which cause calcific barrier. So basically, if it gets in contact with the vital cells, it will kill the cells and it will cause necrosis, and this will stimulate the body to form a calcific barrier as a stop to prevent the spread of the calcium hydroxide, and causing more necrosis of the tissues that's around. It's very cheap, and it's very good in drying wet canals. Sometimes you can't dry the canal after root canal treatment. After you finish instrumentation, you try and try and try. Sometimes just either pus coming out or just tissue fluids coming out. You can't dry, so it's a good idea to dress it with calcium hydroxide and book the patient for another appointment at which the canal should be dry, and you can just finalize the treatment, do the obturation, and finish the root canal treatment. Again, it forms a calcific barrier by the cytotoxic local necrotic effect, and that can be used in cases of trauma cases when the root stops developing and it stops with the open apex, so the apex is not fully formed, and it used to be a treatment where you introduce calcium hydroxide where it just forms calcific barrier. And it also can be used if you did the pulp exposure, you were doing a cavity preparation for a filling, and you had a clean pulp exposure, you can just place calcium hydroxide and it will form calcific barrier dentine deposition in tertiary dentine deposition, and this will repair. And then if the patient is asymptomatic and the tooth is still vital, you can do a filling. That was the end of this lecture. I hope this was useful. We will get back to the more in depth with just antimicrobial strategies and irrigation and irrigants in the 4th and 5th years. This was just a brief overview of the irrigants that's used in endodontics. I hope this was useful, and if you have any questions, please let me know in the email that will be listed with the lecture link. Thank you.